The shipment of AstraZeneca shots under the WHO-led COVAX facility has arrived in the Philippines. But just as when the country starts to get hold of jabs, over 3,000 new cases have been recorded for the third consecutive day. A research group even warns that daily infections might spike up to 6,000 if the current COVID-19 trend continues. Given the rising caseload, the mayors in the capital region meet to reassess the COVID-19 measures currently in place. And in sports, the PBA formally recognizes the top performers of the season in an awards night held at the TV5 Media Center. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Riza Diaz. The Philippine government welcomes more doses of vaccine from Swedish-British manufacturer AstraZeneca. 38,400 jabs from the pharmaceutical company arrived before 7 in the evening at the NAIA Terminal 3. These make up the remainder of the initial tranche of COVID-19 vaccines from the World Health Organization-led global initiative COVAX facility. The doses will be transported to the Health Department's storage facility in Marikina. Recall that only 487,200 out of the 525,600 AstraZeneca doses were turned over to the Philippines last Thursday, reportedly due to cargo limitations. Now, as for the country's COVID-19 caseload, the Health Department reports over 3,200 new infections, marking the third consecutive day this year with above 3,000 fresh cases. That brings the country's total caseload to more than 594,000, around 36,000 of which are still active. Nearly 95% are mild and asymptomatic cases. The virus claimed the lives of 51 more patients in the past 24 hours, bringing the death toll to more than 12,500. Now, some 545,000, meanwhile, have gotten better from the disease, with over 10,500 new recoveries reported today. With COVID-19 cases steadily breaching the 3,000 mark, OCTA research warns of a surge at a higher rate than of last year. Giving us details on the recent report, Professor Guido David of the OCTA Research Group is joining us live. Good evening, sir.
Yes, hi. Good evening again, Riza.
Sir, OCTA projects 5,000 to 6,000 daily cases by the end of the month. Can you run us through how we came up with this figure?
Yes, basically, we measure the rate of infection that's happening right now in NCR. It's about 1.66, and then we made projections based on that. Right now, we're seeing about 3,000 cases on average, and it appears that if the trend continues, we'll be at around 4,000 cases, I believe, by next week. And if the trend continues still, then we will be approaching 5,000 to 6,000 cases per day in the whole country by the end of this month, based on the, again, the projected reproduction number. So we're not saying that this is what will happen. What we're saying is, if the trends continue and we do not reverse it, this is what will happen.
Professor, 4 cities in Metro Manila were classified as high-risk areas. But when we look over at the data, these LGUs don't necessarily have the highest number of cases. What factors are we looking at before classifying an area such as those as high-risk?
Yes, we go by the attack rate, and this is actually what the Department of Health uses as well. And many other countries use these. In fact, we adopted a scale used in Germany. And just to give a brief overview, the attack rate gives us the number of new cases relative to population. So, of course, Quezon City will have a lot of cases, but relative to its population of almost, I think, 3 million, then we can see which LGUs have a higher attack rate. And this attack rate basically tells us that if we go to a public place with, let's say, 100 people, or then the probability that one of them is, going to be infected will be higher in an LGU with a higher attack rate or a high risk classification. So, these are just measures used internationally. We adapted them, and this is what we are seeing. So we see 4 LGUs with high attack rates. That means the numbers are high relative to their population.
Sir, among the group's recommendation to arrest the spread of the virus is a more effective localized lockdown. Does this mean our localized lockdowns so far are lacking? And if so, what aspects can we improve on?
Well, that's a very good question. I would say that it's lacking. What we have, I mean, we do commend the city of Pasay for instituting a localized lockdown very quickly. Um, what we are seeing is that it hasn't curbed the trend yet. Although cases in Pasay may have slowed down just a little, the problem is the cases have now infected several other LGUs in Metro Manila. And well, we could look at Cebu City, for example, as an example. They did not go back to GCQ or even MECQ. Their strategy was to use localized lockdowns, and right now the trend is already decreasing in Cebu City, Mandaue, and Lapu-Lapu. Of course, Cebu is a different concept compared to Metro Manila. The situation is different. A population in Metro Manila is much higher, about 15 or more times higher, and the density is much higher as well in Metro Manila. So what worked in Cebu City will not necessarily work in Metro Manila. Now, you're asking what could be improved. Well, of course, that would depend on the LGU that's examining this. Perhaps maybe a stricter implementation of the localized lockdown, or maybe a longer period of a localized lockdown until the cases are curbed in certain areas which have a high attack rate. Some barangays have a high attack rate. So these are some of the things that could be tried. But basically, our argument is that if something is not working, we need to improve it or intensify it, because we cannot really be complacent at this point, because the projections show that if nothing changes, we will be in a crisis by the end of this month, and we don't want that to happen alongside our vaccination program that's just started to roll out.
Sir, OCTA suggests that the government reconsider the lifting of the travel ban. Can you give us more details?
No, actually, we're not in favor of the travel ban per se. What we recommended was a stricter implementation of international travel guidelines, or if not an implementation, at least let us reconsider our protocols for international travelers. Because our current protocols states that incoming travelers, whether they are ROF or tourists, can undergo testing on the fifth day. But what we noticed is that on the fifth day, based on some scientific papers we looked at, peer-reviewed papers, even on the fifth day, the rate of false negative due to PCR is about 20%. That's just a range. And what that tells us is that there will be some people who will test negative even on the fifth day, but they will still carry the coronavirus. And if we let them out, then that suggests that maybe we are not too strict with our border controls. I mean, we already have incidents of the South African variant and the UK variant in the country. I think that tells us that something is lacking in our border controls, and that's why these variants are coming in. And we can't really afford to let other variants come in, especially the Brazilian variant, which is a lot more contagious, and it will potentially disrupt our vaccination program And we really have to reconsider our international travel guidelines.
Well, thank you, sir, for joining us this evening. That was Professor Guido David of the OCTA Research Group. Metro Manila mayors convened with the DOH on Saturday to reassess the current COVID-19 measures in the capital. In an interview with us earlier, Navotas City Mayor Toby Tiangco said majority reiterated the deferment of businesses such as cinemas and gaming arcades. Tiangco underscored the importance of being mindful of quarantine protocols since most of the infections take place within households. He added that the biggest loophole in curbing the spread of the virus is the lack of rigid protocols not only in households but also in workplaces.
So, kailangan talaga doon sa loob-looban, stricto ang pagtupad ng health protocols. Dahil kung hindi, bago sa dumating sa opisina niya, madami na siyang nahawaan o nahawan siya.
And in sports, the PBA honored the top performers of the 2019 season and the 2020 bubble campaign. The PBA Press Corps held its virtual awards night earlier at the TV5 Media Center. This was a 2-in-1 ceremony as awardees of the previous season stood side by side with their counterparts after last year's event was called off due to the outbreak of COVID-19. Several players and coaches received awards for their excellent display during the 2019 season and the 2020 bubble campaign. The virtual awards night will be aired at PBA Rush tomorrow at 7 p.m. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.